Do you think that our disease readiness and our ability to respond effectively is more of a scientific problem or really a human behavior one? And if it's the latter, how can we address the deep divisions and
Right.
deep skepticism of science that we see in this country?
Well, I think you just hit on the most important aspect of our weakness in response. I don't think it's scientific. I think we've done very well scientifically. I think it is a human element issue. I think the worst possible thing that you could have, the worst possible situation that you can have when you're in the middle or the beginning of an evolving pandemic is the profound degree of divisiveness that we have had and still have in our country. I mean, it's like being at war. The common enemy is the virus, and we were acting in many situations and in many respects as if the enemy were each other. Political, ideological issues determined whether someone would wear a mask or not, that determined whether someone would get vaccinated or not. That is really very tragic. That is very painful to me as a public health person that people, good people, got ill and lost their lives because ideologically they didn't want to make use of a life saving intervention.
Yeah, no, it is tragic, I think. And that is probably the challenge ahead of us now if we face any other threat like bird flu, that these same public health measures are going to be potentially resisted.
Yeah, I
Right.
think we have a ways to go that we have got to, first of all, mend the differences among us to try and realize that we are more alike than different. And differences of opinion are healthy. It makes for a very vibrant society. But when those differences turn into divisiveness, then it gets in the way of what I would consider the most effective response in a public arena for something as devastating as a pandemic.